Hi, Dr. Rogers. So today I'm going to talk about the articles that I read about antibiotic resistance and why it's a problem today. So the first question is, how did antibiotic resistance occur, and what did we get? Why did we get to this point? Uh, it pretty much it occurred. Unfortunately, now it happens. It's seen in every antibiotics. There is some resistance in any antibiotics today, and it generally started because of overuse and misuse of antibiotics, like abusing antibiotics unnecessarily. In some cases, doctors, physician would prescribe antibiotics with no serious reasons, and also inappropriate prescriptions also led to antibiotic resistance because um, throughout the time bacteria became mutated and they developed resistance against those common antibiotics. And also another reason why we are facing this problem is because of farming. In farms, they use a lot of antibiotics for farm animals, and when we consume those products of those animals, we also get those constant exposure to antibiotics, and bacteria based on that start building resistance against those antibiotics. So, so the second question: why is antibiotic resistance such a big deal, and why is it? Who does it affect the most? So it is a big deal because people with bacterial infections would not be able to fight against bacteria with antibiotics, and there is no any other way to fight against bacteria but antibiotics. If antibiotics are not powerful enough, if they're not able to kill bacteria, then in many cases bacterial infections can become lethal for the patients. So, and it can affect pretty much everyone who got exposed to bacteria, who got infected by bacteria, and who's suffering any diseases caused by bacteria. So anyone who has some bacterial infection, those people are infected. It could be general population, athletes, patients in hospital, even like people with people who suffer from very dangerous bacterial infections. Antibiotics will never be able to help them to treat their problem, and that would lead to death. So it's a big problem because of that, and everyone, as I mentioned, everyone can be affected by these problems. So in a societal level, antibiotic resistance again can be caused because of the spread of bacteria, infection from person to person, poor hygiene, poor management of bacterial infections. Also, as I mentioned earlier, the agricultural use of bacteria in animals can also, like everyone consumes, and if you're not vegan, you are consuming animal products in daily basis, and you're being continuously exposed to antibiotics even if your body doesn't really need it. So keep being exposed to same antibiotics or same type of antibiotics, bacteria in a society, in populations, would start to develop the resistance against those bacteria because it's so common in society. And moving to fourth question, talking about the cellular level. So first of all, any bacteria that develops resistance against antibiotics is because of the genetic mutation of the bacteria. Bacteria sort of keep being exposed to antibiotics. Throughout the time, they become mutated and they develop the resistance against those bacteria. So, and they start spreading, and bacteria, they start growing. They're spreading. They're multiplying, and the gene is being transformed from one bacteria to another bacteria. The article talks about that in bacteria, genes can be inherited from relatives and can be acquired from non-relatives and mobile genetic elements such as plasmids. And also another thing that mentions the article is that the horizontal gene transfer can allow antibiotic resistance to transfer among different bacteria. So these are the ways that bacteria can spread, and the same gene being transformed to the generations of bacteria. So the fifth question: what can physicians do? What physicians can do, of course, to prescribe antibiotics only if it's really necessary and there's no any other treatment that helps the patient. instead of prescribing antibiotics like candies and giving away to pretty much every patient with infection, they need to, first of all, they need to do a thorough examination to find out what the cause of the infection. If the infection is because of the virus, if there's a viral infection, then there is no reason to prescribe antibiotics. That must be clear for all patients and for all healthcare professionals. So, thorough examination to find out what the initial cause of the infection is. If it's a bacterial, then in some cases, in most of the cases, they would prescribe, but they have to find out if there's no any other treatment available. Only in like severe cases or in cases where it's antibiotic treatment will be the only option, then they should prescribe instead of just prescribing without any appropriate examinations. So that's that would be a strategy for physicians to avoid antibiotic resistance, just knowing exactly what they're prescribing and limit the amount of prescriptions of antibiotics. And the sixth question that talks about athletic trainers and how can we manage this problem is that, of course, we cannot prescribe antibiotics, but we can educate our patients and those patients who got any infectious diseases, explain them the difference between virus and bacteria, educate them what antibiotics is, which is a treatment against bacterial infections, not viral. And also in athletic training clinics, there are a lot of antibiotic ointments, which we should avoid giving away as candies. Even with some wounds, we don't need antibiotic ointments. We can just wash the wound with other solution like saline solution and cover the wound, and the patient will be fine. So even in our setting, we should avoid using a lot of antibiotic ointments. Only use it in necessary situations where a wound is really severe, is really deep, it's cutting through the multiple layers of the skin, of the tissue, then we'll use antibiotic ointment. If patients are taking antibiotics, it would be good just to find out what the reason is and if it's really necessary, not questioning the physician, but just finding out the initial cause of the infection and why they're exactly prescribed that antibiotic, and just generally educating all patients in which cases it is appropriate to use antibiotics, in which cases it's not. So just educating would be the first thing we can do as clinicians and athletic trainers to avoid the spread of antibiotic resistant bacteria. Right, this is the end of the video. Thank you, Dr. Rogers.